So I'm going to be talking about infant mortality in England as measured by the National Child Mortality Database. And I'm going to be showing you that there is an inequity gap that's both ethnic and socioeconomic. And hopefully also show some data about what I think we can do about it. So the first thing to say is that being born very preterm, very early is the leading cause of newborn brain injury and also child mortality, and that is worldwide. So child mortality up to the age of 18, the single biggest cause is being born very preterm. This is UK data and comparing to the OECD countries. And I've just highlighted here, so the UK is in red squares, and below us is the rest of the high income European countries, and this is infant mortality, and it runs to 2021. What you can see is this uptick in UK infant mortality rates, and you can see we are considerably higher than the rest of countries with similar incomes to us. The only different one is the USA, which is higher than us. So we have a problem in the UK with infant mortality, despite our, the fact that we're a high income country. And the most probable reason for this is income inequality. So this just shows you at the income inequality as published in 2022 by Eurostat. Now, we're not in the EU anymore, but I've added UK and US data here on the end. So you can see we've got high income inequality in the UK. Lower than the US, but considerably higher than most EU countries. And this is a finding: if you've got high income inequality, you have high infant mortality rates. And this is just data published not so recently, 2021-22, looking at children living in poverty in our country, in the UK, and you can see there's a third of children are living in poverty in the UK, and you can see there's wide variation across the different regions of England. Scotland notably much lower. And this is child poverty after housing costs. And of course, this has gone up since the cost of living crisis. Now, national child mortality data, we've been collecting data since 2019, and we collect data under the Children Act, so that is our statutory basis. And this just shows you infant mortality, so deaths under the age of 1. And an interesting finding here was that 69%, almost 70% of all deaths under 1 are actually caused by prematurity. We know prematurity is strongly linked to social inequalities, ethnic and economic, and we know that in our country preterm birth rates are going up, particularly under Black mothers and mothers from South Asian groups. So you may have seen these publications recently. So this was in November last year. Guardian covered this, BBC covered it. Child mortality rates are rising in England. And this just gives you some of those data. This report is available publicly on the National Child Mortality Database, and all these graphs are there. And what this just shows you the data since we've been collecting from 2019-20 up to 2023, most recent data. So this is more recent than ONS. And what we can see here is that all infant deaths, the infant mortality rate is rising. So we've now had 2 years in a row where it's rising. Most developed countries, the infant mortality rate is actually going down. So if you've got a rising infant mortality rate, you have a problem. And you can see it's particularly being driven by extreme preterm birth. And concerningly, if you look at this split by deprivation quintile, so the most and the least, 20% most deprived neighborhoods versus the 20% least deprived neighborhoods. Again, we're looking at 2020, 21, 22, 23 data. You can see that the least deprived infant mortality rate is stable, but it's been driven by a sharp rise in our most deprived communities. And if we look at ethnicity, so we use the ONS categories. Same data again, 20, 21, 22, 23, infant mortality rate. You can see that there's this massive increase in our Black or Black British infants, also in Asian or Asian British infants, but notably our white infants that the mortality rate is stable. So this shows you that there's quite a lot of disparity going on here. And the disparities are widening. This shows the infant mortality rate by English regions, and the dotted black line again for the same years. The black dotted line is the average infant mortality rate for England. You can see it's rising. But you can see this regional variation quite clearly. And the southern regions are all below average, and the northern regions are all above average. So there's a very big north-south divide here. And if you look at the Marmot report, it's the regions that have the highest deprivation that are above the average line here. Now, just putting this into context, so this is the most recent data from Europe and Central Asia on infant mortality rate 2021. And what we've done here is to put, this is World Bank data, and we have superimposed here the National Child Mortality Database infant mortality rates. So this England NCMD data average is here in the middle green. But then if we split by most and least deprived quintile neighborhoods, just look how it splits out. So our least deprived quintile really is amongst the best countries in the world. You know, countries like Sweden, the Nordic countries all have very low infant mortality rates. So it shows you we can do this, but it's in our least deprived 20%. Our most deprived 20% are up here, together with countries like Bulgaria, Romania, Bosnia, Serbia. So worlds apart. And again, if we look at ethnicity in the same way, English average data here, England white ethnic group down here, together with Denmark, Germany, and then our Asian and Black ethnic groups are right up there amongst countries that actually have a much lower income and much less organized healthcare system than we have. And if we now put in the 22-23 data, where I've shown you that the disparities are widening, you can see what's happening. Our most deprived neighborhoods are moving, worse in the ranks, and our least deprived quintile neighborhoods are actually improving. And the same thing we can say for ethnic groups. So our white ethnic infant mortality is improving. We're moving closer to the Nordic countries, and our ethnic minority groups are getting worse. Now, we published this report in 22, looking at the contribution of newborn health to child mortality across England. And we actually looked at mortality up to the age of 10 years. And what we showed here was that newborn conditions presenting in the newborn period actually contribute 72% of all deaths up to the age of 10 years. So there's a long tail of effect if a baby is born with a condition at birth. And I'll show you in a minute what the big ones are. So this graph just shows you from 0 to 10, the birth years. And I know this group's interested up to the age of 3. And then we look at the conditions contributing to mortality. So we can see preterm birth in orange is the biggest contributor, 60%. And for infant deaths. And if we look at the black line, congenital anomalies, so genetic inherited disease is the second biggest one, about 40%. And then you've got other conditions here that, so birth complications, for instance, also contribute. But you can see where, if you have to start addressing these problems, where you need to focus. Preterm birth is a really important one, and also congenital anomalies. Then we did this report. So all these reports are in the public domain. This is our first report on the contribution of social deprivation to child mortality in England. And, you know, the stark headline out of this was that over a fifth of all child deaths in England might be avoided if children living in the most deprived areas had the same mortality risk as those living in the least deprived. And the foreword in this report was done by Sir Michael Marmot. And I'll just show you some graphs from that report. So here we're looking at the centiles of deprivation, so 1 to 10. So the country's divided in 10% aliquots, if you like. Least deprived 1, most deprived 10. And this just looks at the number of child deaths by deprivation centile. And you can see the social gradient, massive social gradient. And if you look at the different causes of death, so all deaths are here, all causes, and then we've got different, here we've got congenital anomalies. You can see the social gradient there. Sudden unexpected deaths in children and infants, you can see it as well. You can see it in every single cause of death. And perinatal, neonatal events is the biggest one contributing to infant mortality. You can see how stark it is there. The only cause of death where you don't see it is malignancy, but every single other one you can see it. And suicide, actually, you don't see that, the social gradients either. And we've quantified the contribution, so the relative risk of dying for each increasing centile of or decile of deprivation is 9%. So that means your relative risk increase for mortality increases 9% as you move along up the social deprivation scale. Another recent paper we've done, which was published, I think it was January this year in JAMA. And what we've done here is to try and untangle the effects of deprivation and ethnicity, because these two things are often very strongly linked. And we've looked at infant mortality, and we've looked all the way from 2019 to 2022. And what we showed here was that if you look at ethnic group and infant mortality, we use the white ethnic group as the reference. Our Asian infants, 66% higher rate of dying compared to white infants, and our Black infants almost double. And if we then look at bringing in, so in a model, bringing in deprivation as well. So you've seen this graph before, so most deprived 1, least deprived 10. And now we've looked at by different ethnic groups and the risk of death per 100,000 person years. You can see this clear social gradient in our white population, and you see it also in Asian and Asian British. Just you can see the risk is much higher in our most deprived groups, so general mortality is higher. But our Black or Black British group is different. Here the risk of death remains high all the way through. So from most deprived, it's only really when you get to your 2 least deprived deciles that you can see it drops. So there's clearly something else at play here. And we've done further modeling, looking at impacts of different causes of death. And what this all means is that all infant deaths, 12% is the population attributable risk fraction. So that means being from an ethnic group other than white, the population, the attribution to the rate is 12%. So you would, if all our infants had the same mortality rate across all ethnic groups in England, we would prevent 12% of child deaths, infant deaths. And if we did that, we would be placed amongst the best European countries in the world. So that would just eliminate that big gap that I demonstrated earlier. And if we look at the population impact, for instance, preterm birth, so being from an ethnic minority group, 12% of all preterm births is attributed to being from an ethnic minority group. If we look at underlying disease, so that's congenital anomalies, that is almost 22%. And if we look at infection, it's 11%. So this starts telling you where we need to focus if we want to start eliminating, closing this gap. And the conclusion from this paper was that the proportion of infants who die is heavily patterned by their ethnicity, even when we've adjusted for deprivation, population impact compared to white babies of 12%. And as I said, an over-conservative adjustment for deprivation did not explain these patterns. And around half of the population impact may be due to increased risk of preterm birth in our Asian and Black communities. So that's clearly an area where I think research needs to start to focus. And if we manage to reduce the preterm birth rate, we would start seeing an impact. Now, the other thing the National Child Mortality Database does is it collects data on the modifiable factors. So all child deaths in England under the Children Act go through a child death review process, which is very comprehensive, and child death overview panels at the end give an independent review on the cause of death and also the contributory factors and whether they are modifiable. And a modifiable death is defined where there are factors which may have contributed to the death and where these factors by means of nationally or locally achievable interventions could be modified to reduce the risk of future child death. So it takes a view into the future, it doesn't look at that particular child death, but starts looking at what can be done about improving things for the future. Now, 31% of all deaths, infant deaths, have modifiable factors, 1 in 3. And what we've done with some extended analysis of our deprivation report is to start looking at deprivation, but also modifiable factors, to start drilling down into where can we start focusing interventions. This was published, it's open access, BMJ Open. And what we showed here was the, again, the same graph. So least deprived, 1, most deprived, 10. And we've looked at the modifiable factors, number of deaths with modifiable factors identified. And the different colors show you the different categories of cause of death. But if we look perinatal, to, which is the majority of deaths under 3, yellow, you can clearly see that your number of modifiable factors are increasing as your deprivation increases, your measures of deprivation increase. So that means you're more likely to die with a modifiable contributory factor if you are poor than if you have from a high income family. And this is just quantified, through modeling, looking at your relative risk of dying with or without a modifiable factor and your deprivation measures. So you can see that you're more likely, your relative risk of dying with a modifiable factor is 3-fold if you live in the poorest regions of England. So what are those modifiable factors? So we look at them in different domains. So the first, this is a very big slide. So the first is the domain is the child, and in there we also include the mother, so the pregnancy factors, service delivery, and these are all services, not just healthcare, so education, social care as well, social environment, and the physical environment. And you can see the biggest number is smoking in pregnancy and other pregnancy factors. And sorry, the boxes, oh, there we go. Maternal obesity during pregnancy. So these are public health interventions potentially. And alcohol use and substance misuse, big ones. Service delivery, also big factors. So lack of involvement of appropriate services. So this is usually about access to care, poor communication, resource and equipment issues, and other service factors. Social environment, challenges with access to services, abuse or neglect, and importantly, mental health condition in a parent or carer. And physical environment, we've got poor home environment. And under here, we have a big group of infant deaths that are actually living in temporary accommodation. So that's a big factor that we've highlighted, and that is actually also gone through an all parliamentary group in Parliament. So, and then the other thing we did with this paper is to untease the measures of deprivation into their separate domains and to try and pick out what are the biggest contributors to mortality. And you can see here in red are the ones that have come up. And many of these it's wider social determinants. So to tackle this, you need to focus on employment, adult education, wider barriers. And these include, as I've put here, issues relating to housing, such as affordability and homelessness, indoor living environments. And then congenital anomalies, well, you can see across, the different, but all deaths really are these ones. Wider barriers in indoor living environment. And if you think about the work Michael Marmot's doing on Marmot cities, Marmot areas, he's calling it now, it actually focuses on a lot of this. So this is about maternal health and lifting people out of poverty, improving education and improving employment potential. So I'd just like to acknowledge my big team, and all the child death overview panels, of which there are over 40 that collect these data for us, and our steering group, and also all our partners, and the charities that we work with, the SANS, Lullaby Trust, and Child Bereavement UK. And please follow us on Twitter, and you can also sign up to our newsletters if you're interested. And I'll leave you with this slide from the great man. Happy to take questions.
Thank you so much, Karen. Really, really helpful, detailed, and important results. And I learn something from you every time that I hear you speak, something new. And I think that's the key thing that we're seeing here with your work and the work of the National Child Mortality Database, is that these are new findings, and they're findings that we can't just ignore. And I think, there can be a perception that this is something that we already know all about, or politicians have been hearing about for decades, which of course, on the one hand, they have. But on the other hand, when you are really digging deep into the new data, the new way of doing things, and this new way of reporting, we're learning so much.